I look at you, right?
Yes, okay.
Okay.
Rolling.
Fluoxetine for like 2 to 3 months.
Fluoxetine and fluvoxamine.
Fluoxetine, fluvoxamine, mirtazapine,
I was on Lexapro. I was on it for 2 years.
Lexapro, bupropion.
Fluvoxamine, fluvoxetine, on off about a year.
I was on fluoxetine for 4 months.
Vanilla vaccine since last year.
I was on clomipramine for about 2 years in total.
The names you've just heard, they're also known as the happy pills. But really, they're antidepressants, medicine meant to treat a variety of mental conditions.
OCD and clinical depression.
Bipolar disorder.
I was binging a lot on food.
Anxiety disorder.
Anxiety and panic attacks.
I mean, they told me that I was depressed.
In this 1-hour special, I find out why so many of our young adults are on antidepressants
It helps me go about my day. I'm able to actually function.
and discover how easy it is to get them.
Prozac you have left, 20 mg you have.
Yeah.
Are antidepressants really the answer to our mental health crisis?
So she was supposed to come for an interview. She said, I'm so sorry, I'm having a really bad breakdown and my medication is running out. So can we reschedule?
Is the happy pill becoming a ticking time bomb?
What would happen if a generation of Singaporeans become reliant on antidepressants?
I was 20 when I took antidepressants. Back then, I may have looked fine on the outside, but inside, that young man was really suffering. I remember feeling a sense of anxiety, despair, and as though there was a gaping black hole in my chest. And when things got too difficult, I decided to see a psychiatrist. He prescribed me an antidepressant. When I first started taking it, I thought it wasn't working. So after a few weeks, the doctor prescribed me a stronger one.
I know I've been MIA for like a month. Things were not going well. I got admitted into IMH 2 times in a month. Not funny. I do have major depressive disorder. Wellbutrin is one of the antidepressants which work the best for me. I feel a lot better. I feel a lot more energetic. I feel more excited to do stuff. Okay, so I'm on 3 different medications right now. The newest one will be the lorazepam. This one is to help with my anxiety. And then the next one would be the Stilnox for sleep at night. And for daytime, it's Wellbutrin. Wellbutrin is actually for my depression. After I got on Wellbutrin, which was like, I think maybe 3 or 4 years ago, I suddenly saw a change in the way I see life, or like how I actually find a little bit more strength to go through my day. I've been taking it since I was 15 or 16. Yeah, that was the first time I got on antidepressants. I don't know what's the science behind it, but it does help me to get rid of a lot of like those depressive thoughts. It helps me go about my day. I'm able to actually function. Otherwise, all I want to do is just stay in bed and not go out. Okay, so I take the Wellbutrin about twice a day. Once in the morning when I would just wake up, and the other one maybe around 2 or 3 o'clock. This would get me through the day, give me that energy I need. So I do feel anxiety all the time, especially when it comes to meeting people. Even this whole interview makes me anxious.
According to Singapore's Ministry of Health, in the last 2 years, at any one time, there are over 50,000 people on antidepressants. But dig deeper into these numbers, and that's where it gets worrying. The number of young adults being prescribed antidepressants has been steadily rising since 2017. After a small dip likely due to COVID-19, the percentage of 18 to 24-year-olds taking these pills stands at 14% in 2023. I have 53,000 pills here. One pill to represent every person taking antidepressants. And there's someone I need to bring this to.
Doctor, this is a visual representation of the number of adults who are on antidepressants in Singapore. 50,000 people. And these are the young adults, aged 18 to 24.
That's enormous.
Could we be overprescribing antidepressants?
Well, it depends on which doctor you talk to, because antidepressants are prescribed not only by psychiatrists, but also neurologists, pain specialists, even oncologists prescribe, and also the family physicians, the GPs. So different specialties will prescribe them for a particular reason. Among the psychiatrists, I don't think there's an increase in the prescription, but there could be an increase among the GPs because they are better trained now, they are more confident in the diagnosis of depression, and they are prescribing more antidepressants.
Could it be possible that our young adults are turning to antidepressants too quickly?
In our training to of the doctors, we ask them to be more careful. We don't want to be, at one time in North America, they call it the Prozac generation. Everybody needs Prozac to go to work. So I think medicines are good, but use it judiciously. Some patients, we realize that after being on antidepressants, they would still want that particular medicine to help them every day. So it's become a psychological dependence rather than a pharmacological dependence.
So then does it concern you that this generation could possibly be over-reliant on antidepressants to function?
Yes, this is a concern of everyone. So I think we have to rethink that our approach in helping young people, that there are other non-drug approaches. If for the GPs, if they're prescribing more, we have to be more careful. We have to make sure that they understand the long-term effects of the medications, but also the costs. It might increase the bill size for the patient.
When it comes to prescribing antidepressants, do doctors prescribe it more easily than compared to sleep medication or anti-anxiety meds?
Well, compared to sleeping pills and anti-anxiety medicine, GPs in general are more cautious about prescribing antidepressants because antidepressants have more side effects for the heart, for the eyes, even for your bladder.
Can anyone prescribe it?
Well, all doctors are licensed to prescribe the medicine.
When I was in the army in 2014, I remember talking to this GP that I was struggling to sleep, and he only had 5 minutes with me, so I felt like he didn't really have time.
I would say going to a psychiatrist is more appropriate so that they will know what to diagnose, and some GPs might not be equipped to handle.
Family doctors in GP clinics and polyclinics are licensed to prescribe antidepressants.
There are no studies to show the proportion of antidepressants dispensed by a GP. But what we do know is that a 2016 study showed that among those who sought help for mental health issues, 20% consulted a GP.
We went to clinics across Singapore to find out how GPs are prescribing antidepressants.
So we will have to refer you to our health wellness clinic.
Some people are averse to taking medications. I think you see a psychologist there. Depression causes insomnia. In that case, I usually use something called methazapine. And if you're really reluctant to see a specialist, I can try methazapine. Okay, methazapine usually helps. It's very good for young patients, easy to take once a day. It usually lets you rest at night.
Do you suddenly cry or tear or feel the life is worthless? Actually, it's okay to cry. Sometimes the more you hold your emotion, the more you feel this. You can try with some medication. Maybe I need one of this. So I see you on Monday. So medication will help you up certain point. So I will give you something which hopefully has the side effects, and then you try that and see. You may feel a bit different because it works on the brain. Also, you must get used to that. Some people feel a bit irritated or very energetic. We can give you some medicine, some antidepressants to help you through. Maybe it will help. You can try it. It's supposed to increase your mood. So what I suggest, I give you something that can help you to sleep also at the same time. The thinking, you're more clear.
Of the 10 clinics we went to, half were willing to prescribe antidepressants. The other half either offered us non-antidepressant medication relating to insomnia or anxiety, or didn't prescribe any medication. But what was interesting was that out of the 5 who were willing to prescribe the antidepressant pills, only 2 of them went into details of the side effects.
The side effect is a bit dry mouth, maybe slight sleepiness. Some people feel a bit irritated or very energetic.
I said, were there any side effects that I should know of, any dangers of taking this? He goes, oh, a lot of kids are actually taking it. Not to worry, Zen will be fine, and he doesn't have to take it long term.
There are at least 20 types of antidepressants available in Singapore.
So when I was taking clomipramine, this was years ago, I had a couple of side effects. I gained a lot of weight. I had dry mouth, and the last one was low libido, but not anymore. So when it comes to these side effects, what other side effects can people expect?
Most of the side effects for the newer generation antidepressants are generally mild, and they will go away in a few weeks' time when the body adjusts to the medication. And most people might experience gastric discomfort, which can be relieved by taking their medications after meals. Okay. And they might have difficulties sleeping in the initial period for some of the antidepressants.
And are warnings of these serious side effects printed on the boxes?
So the side effects will be explained to the patients when the doctor is prescribing, as well as the pharmacist will also provide this information when we explain to the patients during the beginning of the treatment. And they will be provided a leaflet to explain all the side effects that they might experience.
Some people love skinny and they want to be skinny, but then I've gotten so many messages saying they are concerned because I look unwell, and I'm like, why do I look unwell to you? And I realized maybe it could be because of the vein that's popping up recently when I went on this new batch of medication. Even my arms, they tend to be super veiny. I don't know if you noticed this, but like the antidepressants cause very, very obvious veins around my head, like my temples. There's very obvious veins.
There was a specific side effect that I felt the moment I took an antidepressant, and that was having an energy ball in my chest. It was very palpable because I could feel it. It spread through my chest, and this repeated on multiple times.
I love to talk, but the moment I took the medication, I just stopped talking. I just wanted to be alone. I just wanted to like lock myself in my rooms and just sleep throughout the day.
The nausea was the worst, man. Like I remember actually like marching, and I couldn't even march straight. Or the first like few days when I was like taking it, was like actually like pretty dang bad.
So when I started taking antidepressants, I already felt even worse when I expected to feel better. And then eventually I decided to take my life, and then I ended up in the hospital.
These are just some of the leaflets I managed to get that can be found within different boxes of antidepressants. I mean, everything is in the fine print, but to be honest, I can't easily find the side effects for each antidepressant. Another thing to note is that not everyone receives their medication in boxes. Oftentimes, it's Ziploc bags without any of these. To be fair, all the information on side effects of these medications can easily be found online. Nausea, dizziness, difficulty sleeping, headaches, trembling, decreased sexual drive. But wait, what is this? For young people below the age of 25 years, this medication may cause the following changes, especially in the first few weeks of treatment: worsening agitation, restlessness, new or worsening thoughts of harming yourself or ending your life? I didn't know this was a side effect when I was taking antidepressants. And how is this even possible? Aren't antidepressants supposed to stop those thoughts, not worsen them? Now, this is an information leaflet that you would get from a public institution in Singapore when you collect your medications. It's very thorough, but you can't find the warning all the way till page 4. And it's a 5-page leaflet.
In the US, this is a black box warning. It's a bold-faced text that is clearly stated on the front of a medication leaflet. In Singapore, there are guidelines to ensure that all warnings are included on patient information leaflets, but the placement of where it isn't specified. Out of the 10 clinics we visited earlier, only one warned us of this hidden but deadly risk.
There are all kinds of antidepressants and they come with side effects. Okay, you see this? They come with increased suicidality. Typically, they come with a black box warning. That means you take it, sometimes the side effect is that it makes you feel worse before it makes you feel better. Most of the modern day antidepressants are like that, especially for young adults. So what if we don't go down the medicine route first?
This is a document put together by a group called the Please Stay Movement, an advocacy group that hopes to prevent suicide among young people. It recommends some precautions when dispensing antidepressants to youth, including more prominent warning labels and mandatory signed consent by parents. I'm going to be speaking to someone who played a key role in this report.
He is a natural sportsman. He loves skateboarding especially, and scuba diving and hockey. And he's an extremely empathetic friend. We were approached by the hospital if we want to donate his organs. And we didn't hesitate because I know that that's what he would want. Yeah. So we did. He took his own life, but he is 6 back. Yeah.
Why was Zen prescribed antidepressants?
We noticed he was a little bit withdrawn and sad on some days, and he started to self-harm. I brought him to see a psychiatrist, and the psychiatrist said Zen has generalized anxiety disorder. Let's prescribe him with an antidepressant. And at that point in time, I asked him, I said, were there any side effects that I should know of, any dangers of taking this? He goes, oh, a lot of kids are actually taking it. Not to worry, Zen will be fine, and he doesn't have to take it long term. So the doctor prescribed him with 2.5 mg to start with, and for 2 days, I think it was okay. And then within a week, right before leaving for Australia again, I brought him back to see the psychiatrist, who then quadrupled his dosage. So when he went back to Australia, first 2 days I think was fine, but it was very quick. He started acting really erratic, very withdrawn, and that was when I know something's just not right. Yeah. So I made plans to immediately fly up, and that night he FaceTimed his dad, who was in Singapore, and said, oh yeah, I'm going to go to the gym, and then I'll be back at the dorm. But apparently, he went back to the dorm he took his own life at 1:30 in the morning.
I'm so sorry.
That was just like within not even 3 weeks of taking the antidepressant.
So it was the first 3 weeks.
Yeah.
I know this is very difficult, and unfortunately I would still have to ask, because at the end of the day, how do you know that it's the antidepressant that led to that?
Antidepressants certainly has its role, and it has helped many from recovering from the mental illness, but it's only a question of ensuring that the adverse side effects are closely monitored, and especially if you're dispensing it to use at the age of 25 and below. If I have been forewarned of the adverse side effect, my decision would be, okay, Sam is just 2 months away from graduating, and he's going to be coming back to Singapore. You know, it's not like he's in the worst situation that he needs to start on antidepressant. I would have waited for him to come back, and then I would let him take it because I'm next to him. Yeah, I will monitor him, right?
You were part of these recommendations about dispensing of antidepressants to young people in Singapore. So what's the general consensus when it comes to dispensing antidepressants in Singapore?
The guidelines are there. There's no doubt about it. But is there a watchdog that ensures doctors follow the protocol? There should be very clear black box warning, yeah, on the original packaging. And I think even if you are dispensing it in the clear Ziploc bag, even with that, there should be a warning in a separate little pamphlet or something attached to it.
Doctor, so we have an FDA warning leaflet about the increased suicidal thoughts when taking an antidepressant in young adults. It's bolded, it's black boxed. It also directs users to the third page with more detailed explanations. And we have a similar warning in an IMH leaflet that it's not bolded, it's kind of blending with the rest of the information. Why is this warning not more prominent in Singapore?
Well, I suppose there is really a lot of information that we try to pack in. This, I think, could be one way to highlight the more common side effects, to bring it up first, rather than to bring up the scary side effect first. We don't want to scare them away, right? This side effect is also not as common, even from my clinical experience. But I make sure, because it is important, to actually tell them that there is this slight risk. And this risk happens with all antidepressants.
I have the printed copy of what one patient was given in IMH for a medication. And I mean, just flipping through this, we don't really see the warning. It's kind of on the fourth page, and the important notice is printed on the bottom of the previous page. So how could we perhaps improve how these warnings are placed?
It sounds like it is something we can bring back to our hospital pharmacies for feedback and to see how we can improve on this.
How valid is it, this FDA warning?
This FDA warning actually arose from the analysis of years and years of research data. So basically, it didn't arise from any particularly large study, but the cumulative evidence from research that's been done across decades for antidepressants. So what it has shown is that those who receive medication appear to have a slightly elevated risk of developing suicidal thinking compared to those who were taking placebo.
So I remember when I was being medicated, this was about 8 years ago, it did get a bit worse for about the first 3-4 weeks, and then we switched medication, and I did have suicidal thoughts in the initial phase, but then it got better. But I had no idea that this could have also been caused because of the medication. I thought it was just my condition getting worse. So this, how do you know what's causing one or the other?
Okay, to be frank, the data only tells us this is an observation. It doesn't mean that this medication is the cause, right? That this is an association. So what some people believe is that as a person gets treated with antidepressant medication, not all the depressive symptoms improve at the same time. Yeah. So it could be that while the other depressive symptoms were improving, this suicidal thinking may take some time to improve. In fact, there are other studies, coming out, and some studies trying to suggest that this risk is actually not elevated. There are even some that try to provide aggregate data to suggest that as a whole, if you look at our populations, young persons who receive antidepressant medication actually do much better when they are treated. So this is an area that we still need more information, hopefully from future research to tell us.
So should parents be concerned?
Well, I would be. So it is therefore not a decision that we take lightly. So generally, when treating a young person with medication, still non-medication approach or therapies are really my preferred first option.
In your experience as a doctor, have you come across young adults or children who are prescribed antidepressants where they do struggle with increased suicidal thoughts?
Yes, I have come across a handful. I would say that still it is not common. It may require a change of medication. We may decide to stop medication and continue with just psychological therapy, for instance. So again, this is a decision that we take jointly together.
I did a quick search on the Health Sciences Authority's requirements for labeling and found that serious side effects must be included in the patient information leaflet, but it doesn't specify where it must be included. That's up to the hospitals and pharmacies' discretion. But what's paramount is that parents should be informed of these risks so that they can monitor their children closely.
Only half the GPs we went to offered to give us antidepressants. Not as accessible as I thought in Singapore. But what if it's easy to get it here?
Do you have Luvox for antidepressant? When I was going through treatment, I remember that I could only get my antidepressants via a prescription through a psychiatrist. And I remember each visit costing about $200 to $300 because it included any consultation fees as well as any therapy that was attached to the treatment.
In Singapore, antidepressants can cost between 30 and 100 Singapore dollars per month if you aren't subsidized. And you need a prescription. I'm here in Johor Bahru, Malaysia.
Mic test 1, 2, 3. Now there are 5 antidepressants that are most commonly prescribed in Singapore. And I'm here in Johor to see if I can get them without a prescription. And I have with me this trusty jacket, which I'm going to wear to hide the mic. Now luckily it's a windy day, so hopefully no one will suspect me. It's time we go undercover. Hi, I wanted to check, do you have Luvox for antidepressant? Yeah, Luvox.
We have 1 box.
Okay. Okay, so that was pretty easy. I just went in, asked for Luvox, and then they checked my passport, got my handphone number to register me with the pharmacy, and then that was it. It was an easy transaction, very easy. Didn't take much effort at all. So let's head on to the next one. Hello, do you have Zolofta?
93.
Okay, can I get one? Hello, do you have fluoxetine? Prozac you have, 20 mg you have.
This one like Luvox.
Yeah. Lexapro? I got 90 tablets. 90 tablets. That's 3 months worth of antidepressants for 156 ringgits. Yeah, incredibly affordable. I saw your sign you deliver to Singapore.
Yes.
So this one also you can deliver?
this one can deliver. We will create a prescription for you.
Oh, you'll create a prescription lah. Okay, so then no problem at the customs or...
3 months quantity we can ship.
Oh, but you pack more inside.
But you request how many boxes, we try our best to ship.
She told me all about the entire shipment that they can do to Singapore, anywhere in Singapore. One shipment costs only 30 ringgit, which she drove home the point that it's cheaper than other delivery providers, and the fact that they can ship up to 3 months worth of medication, which includes antidepressants. And if I want more, they could also repackage the medicines into 3 boxes and try to fit as many as they can. I went to 10 different pharmacies and all of them sold me antidepressants without requiring a prescription. And this is all I got. Now, it was incredibly easy. All I had to do was walk in, ask for the medication I wanted, pay, and walk out. It was as though I was buying anything off the shelf. And some of these pharmacies were even hard selling them to me, saying they could give me a discount if I bought them in bulk, or ship them to Singapore for a fraction of the price, or even repackage these medicines so that I could have more for less.
That being said, I can't with good conscience say this is a safe way to obtain antidepressants, especially if there are those out there that could be over-reliant on them and need to be closely monitored. Also, we aren't allowed to bring in more than 3 months' supply of medication into Singapore. And authorities can't ensure the safety and efficacy of medications sold in other countries.
I call depression like a monster. You really don't know when it's going to come out. That's why you don't really want to just stop your antidepressant without the doctor's knowledge.
A month ago, Tammy went back on antidepressants after taking a 7-month break from them. Since then, she's been struggling to wean off her medication.
I've been suffering from depression for like over 15 years. I stopped taking antidepressants when I got together with my current boyfriend. He actually made me really, really happy, and I thought I was in a good place. And it wasn't a problem until maybe like 6-7 months into the relationship. I'm not sure, but I think my brain went haywire after 5 to 6 months without medication, and I suddenly had very suicidal thoughts. So without the medication, right, I'm very paranoid. I overthink. I am very, very easily agitated. Every little thing scares me. I feel like sometimes when I'm non-medicated, I'm not a good mom. I can't be there for my kids because, like, it's so bad to say this, but sometimes it really like gets to my head, right? And then there's the screaming and everything. I can't deal with it. I can't deal with it. So it's like, wow, I can't even take care of myself, and like how to take care of my 2 children. And that's why, you know, I keep trying different medicines, and I keep trying to stop it as well. Because I keep thinking like, oh, it's not forever, you know. But then, yeah, I'm actually already like in my 30s already. I have to learn how to cope with my feelings. And if I'm able to do that without the medication, then yeah, it'll be good.
I have a friend that runs to antidepressants whenever he feels sad, and he's very dependent on it. And whenever he's on antidepressants, he's always sleeping.
I wouldn't say, oh, I'm over-reliant on antidepressant, or like, oh, without it, I can't function. I just see it as a supplement that helps me lead a normal life.
I'd say that noticeably my mood is very different from when I'm not on it. I have less motivation to do things.
I can't listen to music. I can't watch a movie. Like for 15 minutes, I'll get so tired. I can't concentrate anymore. That's the worst thing about the antidepressant. I can't feel as much. Yeah, so that's why I decided to stop. Until today, I still have anxiety.
Antidepressants aren't addictive, but why do so many find it hard to get off it? And what does it really take to get off these happy pills?
So it's at this point you're just saying you can't make it out of bed to come for this interview at all.
I wanted to, and then in the morning I was like stressed, so stressed.
So I took the decision that I didn't want to take antidepressants anymore. And I wanted to be able to manage my own life without medication. And so I decided to start tapering that medication with a doctor, of course. But when I was letting it go slowly, I realized that I couldn't just quit cold turkey.
So I met people who have struggled before and taken many antidepressants, antipsychotics, and they advised me that, Kevin, this might be a cycle you need to stop. It might be better if you slowly come off it. So I trusted them. I said, I'm going to stop. So in that moment, I decided to wean off medication. I went to my doctor. I told him, Doc, I think I want to try stopping my medication. He was very positive and supportive of my decision, and he slowly helped me to wean off medication. So in about 2 to 3 weeks, I reduced the dosage and eventually stopped it.
When I was facing those anxieties about my future, binge eating came in as a distraction, and I needed the antidepressants probably to put my mood in a better place. But I mean, I had always been regularly exercising, meeting friends, meditating. So now, with all these healthy habits, I do think that, I didn't have to use the antidepressants,
Remember Tammy? We had scheduled a final interview with her.
It's just another day. I just can't get out of bed. In the morning I was like, yes, set the alarms. And then after that, I don't know, then suddenly hits me. I don't know, everything's just, I can't even remember what is what anymore. It's just so stressful.
You sure you have someone to talk to, Tammy? You're not alone, are you?
There are people outside, but I'm just locking myself in the room.
Okay.
So I just don't want to talk to anyone right now.
Okay. So she was supposed to come for an interview. She called me. She was crying. She said, basically she texted me. She said, I'm so sorry, I'm having a really bad breakdown and my medication is running out, so can we reschedule?
I think the whole energy that you are seeing right now is very different from when we first met. I really don't know why I still have this mental breakdown even when I'm on medication. I can't answer that also. I wish I could. I've not thought about going for counselling because I did it before and I didn't really think that it helps because I am actually quite aware of what is wrong. One thing is because I feel like I really cannot have that commitment to go down. I believe I am able to live my life with antidepressants without counselling because I think I have very good friends around me whom I can talk to. Of course, they're not professionals, but I feel more comfortable talking to them than, walking to the counsellor's office. Right now, whenever I have a mental breakdown, I actually have to look for my boyfriend or my boyfriend's mum because medication are all with them. So they would know which medication to give me. And this is actually a doctor's advice that I do not hold the stash of medication with me. Because it has happened many times during my mental breakdown that I actually just take whatever pills that I have and ended up in the hospital. So I don't have the the chance to actually like OD on a certain medication.
Tammy admits she is dependent on her antidepressants. Yet she doesn't believe she needs counselling. She's tried to stop, but has failed. What does it take to wean off the happy pill?
Raina, you've been on antidepressants before. What made you decide to rely less on them?
Yeah, so I think a long time ago, I have Tourette syndrome, and basically I was trying to manage it, and I was offered antidepressants. I have always been a little bit afraid of being too reliant on a medication. But yeah, that's something that I often have a good conversation with my psychiatrist in the context of maybe other options, right? Like talk therapy or seeing a therapist as well. And a combination of both can also work really well. And I just think that if we are just limiting ourselves to just medication, we are not exploring how we can enhance treatment or even provide people with a separate option that does not have similar side effects.
So if that's the case, then why shouldn't we make it mandatory? If someone is depressed, they should also, alongside the medication, also go for therapy.
You might be at different stages of severity of depression because it's not a static kind of situation, right? So at what point do we start enforcing it? Because that means we have to monitor someone and assess their stage of depression or severity of depression over time. And then, okay, are we going to enforce it when you've hit a certain kind of diagnostic criteria? There are a lot of things to consider. I think giving people that freedom to choose, but also making them understand that there are certain benefits of considering both, I think is important.
So why would someone choose not to go for counselling and only rely on medication?
There are people who are potentially are in states of depression where they need the medication to regulate their daily function. And I think this allows people to function at a very basic level and then consider things like talk therapy. That's why maybe having medication alone can be helpful in these instances.
So could it be necessarily bad if someone chooses to only rely on medication?
This is tough because you and I both know, as people who are in recovery, right, that it's quite complex and it's a very personal choice. So I wouldn't say it's necessarily bad, but if the conversation revolves only around medication, if I entered care thinking that's my only option, I think that, to me, is bad, right? Because we don't give people the choice, we don't give people the understanding that there are more options out there.
Raina, we now have a growing number of young adults who are on antidepressants. What would happen in Singapore if a whole generation was solely dependent on medications? Are there broader consequences as a society that we maybe are not considering?
I do think that in Singapore, at least traditionally, we've been focusing on a very medical model towards health, right? So, when we think about depression, it's always, how do we make sure someone is not depressed anymore? If we solely focus on these medical diagnostic criteria, fine. Medication will help us stop having depression. But the broader question is, do you want an entire generation of people who, are just maybe functioning? So if we just have people on medication, sure, we're putting a bandage on these wounds. But are we actually addressing the root causes of, what makes people happy, what makes people thrive, right, in society?
I do think I'll get off antidepressants, but I don't think it will be anytime soon. I believe it should be about maybe 5 to 10 years down the road. I'm teaching myself every day. I'm trying to read more about it. I'm trying to learn more about how to manage my feelings. But then again, when I'm off medication, then the way I react to it, certain things go back to the old ways again. So yeah, it's a lot of self-control.
I think if I could go back in time and speak to young Shrey, who was going through that condition and was about to take antidepressants, I think it would be to tell him it really doesn't happen overnight. It doesn't take effect immediately. Antidepressants are not a happy pill. Antidepressants allowed me to get to a point where I started to go to therapy. Should antidepressants be used as a first line of treatment? I think it really depends on a case-by-case basis. Because a lot of times, mental health issues it's such an undefined space. I think it really requires proper evaluation of at which stage someone is to then decide to medicate. In the early stages of my condition, I went to counselling, I went to speak to friends or family. When all those avenues didn't work, I went to a psychiatrist. So I wouldn't necessarily say that it should be 100% the first line of treatment. I think each person's individual case needs to be studied and understood before we decide.